In this video, I will talk about the anatomical terms. So first is anatomical position. So an anatomical position, the upper limb should be parallel to the torso or trunk. The palm of the hand should face forward, and the thumb should be located laterally. And in the lower limbs, they should be parallel to each other. The feet should be parallel, almost parallel, and the toes should be forward. So this is the anatomical position from anterior view, and this is the anatomical position from lateral view. Some other terms: superior means above, and inferior means below, so they are just opposite of each other. Cranial also means above. There's another name, it means toward cranium or toward head. Caudal means below, or it means toward tail, or it means toward below, so there's different names in it. Anterior is the front, or also another name is called ventral. Posterior is the back, also it is called dorsal. Right and left, everybody knows that. If there is an imaginary line here in the middle area, so anything that goes toward the midline, that is called medial, and if it is going away from the midline, that is called lateral. The proximal and distal is related to attachment. So here you have the lower limb and you have an upper limb, so more applicable to upper and lower limbs. So here, for example, you have the hip. Hip is proximal to the knee, and knee is distal to the hip, or ankle is distal to the knee. Same thing here in the upper extremities. So shoulder is proximal to the elbow, or shoulder is proximal to the wrist, and fingers are distal to the wrist. So just some examples. So cephalic means head. In general, it means head. Frontal is the forehead. Orbital is the area around the eyes. Nasal is the nose or nasal area, so it's the nose. Buccal is the cheek area. Otic is the ears. Oral is the mouth area. Mental is the chin. Cervical is the neck. Occipital is the back of the head, this area. And nuchal is this area, just a small part of the back of the neck. Sternal is the breastbone area. Thoracic is the chest. Mammary is the breast area. Abdominal is the abdomen. Umbilical is the belly button. Scapular is the back. So here is the scapula, so this is the shoulder blades. And vertebral is the vertebral column area, the spinal cord area, this area. This whole area is called dorsum. Pelvic is lower than the abdomen, so this area. Inguinal is this area. This area. Pubic is just above the genitalia. Lumbar is the lower back. And the gluteal is the buttock area. Axillary, underarm. Brachial is the arm. Antecubital is this area, so the anterior part of the elbow. Antebrachial is the forearm. Carpal is the wrist area, wrist bone area. Palmar is the palm of the hand. Digital is the fingers. Femoral is the thigh area. Patellar is the kneecap, so anterior in the knee area. Popliteal is the back of the knee. Crural is the shin, anterior part of the leg. Sural is the posterior part of the leg. Tarsal is the ankle area. Same thing in the back. Pedal is the foot. Calcaneal is the heel of the foot. And plantar is the sole of the foot, so it's like this area, under this area, under this area. Also the body planes, so this is important during surgeries, also for imaging like a CT scan and MRI and X-rays. The body planes are important. So you have the sagittal plane, so that splits the body to the left and right. You also have the parasagittal, so that runs parallel to the mid-sagittal, so runs like this, parallel to this. And you have the frontal, another name for frontal is called coronal, so that splits the body to anterior and posterior. So this plane, anterior and posterior. And then you have the transverse, which splits the body to the superior and inferior parts. If you have any questions or comments, please write it in the section below. Thank you for watching the video. Please consider subscribing, and if you have any questions, please let me know. I will try to answer it, and I will post more videos. Thank you.